Hello and welcome to today's WorkSafe Month webinar, Recovery Blueprint, Introducing Risk Identification in Real Life. I'm Stephanie Morawski from WorkSafe Tasmania and I will be your moderator. Before we start, please take a moment to read the following slide about information received today. I'll now go over housekeeping. Here is a screenshot of the attendee control panel. You should see something that looks like this on the right hand of your screen. You're likely listening in using your computer speaker system by default. If you would prefer to join over the phone, just select telephone in the audio pane and the dial-in information will be displayed. Webcams and audience microphones will not be used in today's webinar. Questions will be taken at the end of the presentation. However, please feel free to type your questions into the questions pane on your control panel at any time during the presentation for answering at the end. Finally, today's webinar is being recorded. I would now like to introduce your presenter, Dr. Ross Iles. Ross is a Senior Research Fellow in the Insurance, Work and Health Group at Monash University. He has a physiotherapy degree and PhD from La Trobe University and a postgraduate diploma in work disability prevention studies from the University of Sherbrooke, Canada. Prior to joining the IWH group at Monash, he taught physiotherapy and research skills to university students for over 10 years. Ross's particular research interests focus on methods of identifying individuals at risk of prolonged work disability, and he has led projects in Victoria, New South Wales and Queensland related to the development and implementation of methods to enable early and appropriate intervention. He is the lead researcher on the Driving Health Project with the aim of improving the health of drivers in the transport industry. Ross's approach to research focuses on developing a partnership to understand not only the problems to be solved, but also to identify solutions that best fit with the demands of all stakeholders. Welcome, Ross.
Thanks very much, Stephanie. Hello, everyone, and thanks for joining in today. I'm really excited to be able to describe to you some of the work we did here at Monash in partnership with WorkCover Queensland to introduce evidence-based risk screening into claims management for injured workers in Queensland. So in this webinar, I'm going to talk a little bit about the research around risk identification and how the research can be used to guide practice. And I'll outline the approach that we tested with WorkCover and describe what was required to put into practice some of the principles that were derived from the research. And then I'll wrap up by describing some of the results we saw when we actually put those new processes into place. So in workers' compensation, most injured workers return to work really quite quickly. Some only require medical treatment, others require a short time away from work before being able to get back to work. However, there's a small proportion who experience a delayed return to work and ongoing work disability. And this small minority consume the majority of the resources devoted to workers' compensation, but not to mention experience really poor outcomes overall. Being able to identify those at risk of delayed return to work provides the opportunity to intervene differently and improve those outcomes. This aim is not new. In fact, when we interviewed a range of industry experts around Australia, the following quote sums things up nicely. It's funny, isn't it? Because everyone's doing the same bloody thing. All the insurance companies are trying to do this and no one's making much ground. However, a big challenge with the research is that it tends to paint a picture a little bit like this, that you can easily identify different categories and park them nicely next to each other. So in this case, a worker whose employer needs support to identify suitable duties could be the blue car. An injured worker struggling to cope with the psychological consequences of their injury could be the green car. So different categories of risk can be easily identified. There are no overlaps. They're parked nicely in the same size car park. However, that brings up the next problem. Even when you can identify what colour they are, they're still parked, and the research doesn't always tell us the best way to get them moving again. So we have to do the best we can with the research that may not necessarily describe the context we are working in too well. But that's okay. We have data. And yes, data is very helpful for risk identification, provided we have the right information. Data-driven models tend to be filled with administrative level information, things like the date of the injury, the type of the injury, the industry the worker comes from, their age, things like that. And it certainly does help with risk identification, but often the most important information that we need to identify delayed return to work comes from the personal domain or specific factors about the worker themselves. And most often, the person best situated to gather that information is the case manager. From their perspective, things look like this. So the case manager has access to the sources of information required to help with risk identification, but there is some uncovering to be done. If you don't look too closely, things here all look the same. But a closer look will show you there are cars of different shapes and different colours, all parked next to each other. Some cars don't need to be looked at closely. They'll actually get moving quite quickly. However, there might be a car in the middle somewhere that actually really needs a lot of help to get going. And bad luck if that car is parked in by a stack of cars around it. And of course, if you ask a case manager about caseloads, they'll tell you it looks more like this. Which isn't ideal. But unfortunately, we know the majority of people with a workers' compensation claim will go back to work quite quickly. So of course, that means the real picture is actually more like this. In reality, workers' compensation is constantly moving, with different vehicles moving at different speeds. But let's move away from the analogy that likens injured workers to cars and focus on what risk identification really is. So risk factor identification is the gathering of information related to a claim for workers' compensation to identify factors that can influence the claim outcome. Now, the purpose of risk identification really can be divided into two categories. The first is to guide the appropriate allocation of resources. That is, we can put the effort in where it is needed. Some people don't need much support to return to work, but others need multiple barriers addressed before they can get back to work. If you can work out who those groups are early enough, you can direct your resources to where they're really needed. The second purpose is to guide appropriate service delivery, ideally in a proactive manner, through identification of the support a worker is likely to need before they realise they need it, or at least before it becomes an actual barrier to recovery. So, for example, working with an employer to identify possible suitable duties so a plan can be put in place for when the worker is ready to resume modified duties. So I started at the start of the presentation talking about the research. So how much is out there? Well, there is actually a lot of research in the area of risk identification. The types of research that have been done can be divided into research that is exploratory or confirmatory. So exploratory research, depending on the methods you use to look, you'll quickly find 30 or 40 different tools that you could use to identify factors that increase the chances of someone having a poor outcome after an injury. You'll find research that shows how well or how poorly tools can predict the outcome. And more recently, you can find studies that actually validate those tools, so test them again, so you can actually identify if they can be applied in different situations. There is a lot of information in this exploratory space. Our review that we did identified over 100 barriers and facilitators examined in the research. However, there are very few studies in the confirmatory space. That is, those that clearly describe the impact of adding risk identification compared to usual practice. You can count on one hand the number of studies that do this, and often the context is quite specific, such as being in primary care in the UK or being focused on psychological support for hospital workers. So that means the results are often hard to generalise across a workers' compensation system or across a single organisation. So where should we go from here? So our partnership with WorkCover Queensland aims to introduce risk identification to workers' compensation case management in Queensland. Knowing the picture painted by the existing research, we first needed to establish what guidance could be drawn from existing research. The overall aim being to research, design and test a new approach to case management. So the first output of the partnership developed the best practice statement, best practice risk identification. This document aims to outline the key concepts underpinning best practice in risk factor identification for delayed return to work, based on the available evidence and knowledge of current practice in workers' compensation case management. The document draws from peer-reviewed literature, unpublished research, and expert knowledge in the field. It really aims to provide an industry-focused summary of the key concepts in risk factor identification. Perhaps most importantly, it set out the principles to guide the development of the recovery blueprint approach to risk identification. So I'll briefly state these principles, but I'll describe them more clearly later on, exactly how a recovery blueprint applied each one. So the first principle, assessing risk across multiple domains. You should assess the worker situation, employer, treatment-related factors. So you need to assess multiple domains. It's important to balance the timing of information availability and the effectiveness of actions. When most workers return to work quickly, collecting detailed information on everyone is unnecessary. But on the other hand, waiting until it's clear that a worker is struggling to get back to work means interventions will be less effective. So balancing the timing is critical. You need to combine different types of information. So risk identification should make use of the information readily available, such as what is on the claim form, but then also information gathered by talking to the injured worker in depth. And you need to use a system that can deliver clear information to decision makers. The system needs to make sure that the decision maker, in our case, the case manager, can access and understand the information, and then most importantly, know exactly what to do with it. You need to gather information early enough to intervene when it counts. Research has shown that the greatest impact of an intervention will happen somewhere between 6 and 12 weeks after injury. Gathering the information needs to allow intervention in this window of opportunity. You need to allow for systematic documenting and monitoring. So the process should be systematic and allow overview of the situation, especially if multiple people will be involved in supporting an injured worker. It should combine automated and judgment-based decision-making. So there are benefits to using algorithmic approaches, but some decisions are best made by experienced case managers weighing up the specific circumstances. Combining the both offers the best of both worlds. Finally, any approach needs to fit the system in place. A rigid rule-dominated approach will not work for case managers used to flexibility in how they support injured workers. So with these 8 principles in place, we developed Recovery Blueprint to introduce evidence-based risk identification to how claims were managed in Queensland. So some context is useful here, especially for those not familiar with the situation in Queensland. So WorkCover Queensland is a government-owned independent statutory body and covering 90% of workers' compensation in Queensland, with the remainder being made up of self-insurers. So effectively, WorkCover covers pretty much all of Queensland workers' compensation. Claims management is done in-house with case managers located in a central location in Brisbane CBD. So WorkCover trains its case managers and decides how they're organised, in this case, into industry-specific teams. So case managers are familiar with the type of duties and the work that the people they are supporting are doing. WorkCover also uses its own claim management software that they develop themselves. So they have control over all aspects of the software being used by case managers. And that was an important consideration when we were trying to introduce a new process. In Queensland, there are around 60,000 accepted workers' compensation claims each year. And even though they have quite strong return rates, a high proportion of workers return to work, there was an internal driver to continue to improve how workers were supported in their recovery and return to work. So in order to develop Recovery Blueprint, which is summarised on this slide here, the research team spent time embedded in WorkCover Queensland to understand how case management works in the WorkCover context, WorkCover Queensland context, and understand the systems already in place. So key case management structures and how case managers work to assist workers in their recovery, rehabilitation, and return to work. With this information in mind, several models of introducing risk identification to case management were identified and examined for fit to the WorkCover context. The best fit for how WorkCover Queensland already operated and the information systems in place was to apply a triage model early in the claim. And that's what we see under phase 1. This separated injured workers according to the risk of delayed return to work compared to the average for a range of injury types. So this took into account information that's available at the very start of a claim. And that could be, for example, the industry that the worker operated in, their age, and their gender, for example. Those workers at risk of a delayed return to work were referred to case managers who made an assessment of the different domains that may impact the injured worker's recovery and return to work. So this occurred in phase 2. Following that case manager's judgment was a further information collection step, such as sending a questionnaire like those commonly used by treating practitioners or otherwise completing an internal checklist. And I'll describe this process in a lot more detail in a moment. The final step involved guiding case manager actions based on that information that had been collected. So to describe how this worked in real life, I'll step through the domains of information that were assessed by case managers in phase 2. So here are the 10 domains of information assessed by the case manager supporting the injured worker. Each of these domains was assessed by the case manager as they're the person that actually has access to all the information to make the initial judgment regarding each domain and the possible impact it might have on the injured worker. And each of these domains had a follow-up step to support the case manager's assessment. In the case of the first 5, it involved sending out a validated questionnaire to the worker. So we'll start with injury. We know that significant injuries take longer to return to work, and we may be able to arrange appropriate care earlier, whether that be specialist assessment or just ensuring that we're monitoring the situation. Via the triage process, the case managers involved knew the person was at risk of a delayed return to work. In order to get an assessment of the severity of the injury, a questionnaire was emailed to the worker according to the nature of their injury. So for example, a worker with a back problem was sent the Oswestry Disability Index, a questionnaire often used by physiotherapists to identify someone's level of functional disability due to back pain. So that questionnaire was emailed to the worker and they completed it and returned it to WorkCover. And the case manager was provided with the score. They also had access to the raw information, and the score let them know if the person was experiencing a high level of functional disability. That is an alert to let the case manager know that the injury was quite severe. Other questionnaires were sent for neck pain, for an upper limb condition and a lower limb condition. I'll move on to the coping and expectations domains. These aim to help identify the level of support needed to help recovery. Case managers were required to assess whether the person was coping with their injury or had realistic expectations of return to work. If the case manager thought either of these aspects were a problem, they could email the short form Arebro questionnaire, a musculoskeletal pain screening tool designed to identify when someone would benefit from further psychological support. A high score on the questionnaire is a clear signal that further support is needed, so the case manager can act. And case managers were trained for different things to look out for that might help them to identify if someone was struggling with coping. Sometimes it can be really quite clear. Sometimes it's more of a feeling a case manager might get after their interactions with the injured worker. For general health, we know that comorbid conditions may delay return to work if not managed well, or at least considered in injury management. So for example, a worker with a lower limb injury who also has diabetes is at risk of just a generally slow healing rate. So case managers were encouraged to discuss with the injured worker if there were other health concerns that may actually impact their recovery. If this factor was relevant, case managers were provided with a checklist to read to the worker to help identify if there were other health concerns that needed to be taken into account. It also enabled the identification of medications, for example, that the worker might be taking, even if it wasn't related to their specific claim for workers' compensation. In this case, the case managers were encouraged to provide a long appointment for injured workers with their GP if there were other health issues going on in the background to make sure they were actually under control, even if it wasn't part of their claim. For social support, We know that social support is important as people are recovering. So this was asking the case manager to identify whether the worker had adequate social support to help with their recovery. If the case manager thought this was a concern, they could email a questionnaire to get an idea of the worker's social support network to help identify what other supports may help with recovery. Now, for all of these factors, an online training package was developed for case managers in the program, which was a new approach for WorkCover, who hadn't previously provided online-based training. And this training provided background to each of these factors and actually required the case managers to complete each of the questionnaires or the tools they would be sending out to workers. So they had a good understanding of exactly what they were sending and what they were expecting of the injured workers to complete. It also helped them to introduce to the worker what the questionnaires were and what they were about, and also why it was we were asking these questions. Because there was that notion that potentially workers might not be comfortable being asked these questions and providing this level of detail in terms of their injury. So did the injured workers like it? Well, yes, basically. We weren't completely sure how they would react, but the average return rate across the questionnaires was around about 75 to 80%. So more often than not, the questionnaires were completed and returned. And we asked more than 400 workers how satisfied they were with the being sent the questionnaires. And the average satisfaction score there is a 4.2 out of possible 5 across those responses. And workers actually stated that they appreciated being asked for the detailed information, as they felt that WorkCover really cared about them in their situation, because they were really trying to get at, really understand them and their particular situation. The next domains did not involve a questionnaire being sent out to the worker, but still included a process where more data was collected and recorded. Again, it was a case manager's judgment on each domain as to whether there was a potential to delay return to work. So for the employer factor, the case manager had to decide whether the employer could support return to work. A responsive no suggested that perhaps the employer wasn't able to provide suitable duties, or maybe they did not know how to. The case manager completing the checklist made for easy data collection around the supports that an employer might need, and can provide future directions for WorkCover to assist employers in their supporting their injured workers. The question asked around provider was whether there was access to return to work focused services. This revolved around not only the provider's knowledge and understanding of return to work being part of the recovery process, but also included access to services. Queensland's a very big place and many workers are located rurally and some distance from specialist care if required. WorkCover knowledge asked case managers to determine whether the worker understood how to work with WorkCover. We know at times that workers' compensation has a lot of processes and paperwork that need to be completed, and this aimed to record the situations when the worker didn't really understand the WorkCover process or was confused by the information they'd received. We know being disempowered by the workers' compensation is a barrier to recovery and return to work, and this aimed to flag if that was the case for a particular worker, so efforts could be made to help them understand exactly what it was that they needed to do. Worker satisfaction. Case managers were asked to determine whether the worker was showing signs of dissatisfaction. Dissatisfaction and disputes over claims decisions has been identified as a precursor to legal action and a drawn-out claim. And quite often that leads to poor outcomes for the injured worker as well. The Recovery Blueprint aimed to highlight dissatisfaction as early as possible to allow case managers to do their best to ensure injured workers were satisfied with how their claim was being handled, and also provide extra information where it was necessary and possible. Finally, the other considerations domain asked the case manager if there are any other factors that may impact return to work. Our previous research with case managers has described a feeling or a vibe that things weren't going to go well for different cases or different injured workers. And this domain aimed to provide the case managers with an opportunity to record something that they felt was not quite right, but wasn't captured under the other categories, to identify something about the worker and their circumstances that means their recovery might be delayed. So those are the 10 domains of risk case managers were required to assess on each claim. Each domain could be completed at any time within the first 4 weeks of the claim being accepted. This enabled the case manager to make their assessment after an interaction with a specific stakeholder, such as the employer, in a manner that suited them, but also in a timing that suited them. A low-risk response could always be changed if the circumstances on the claim changed. So, for example, if the worker was showing signs of difficulty coping as their condition persisted, the response to coping could be changed, and that would then trigger the process of sending out the questionnaire, perhaps later in the claim. If no response was actually recorded for a domain within the first 4 weeks, the high-risk response was selected by default to ensure that the injured worker received the attention they required. So, what did case managers think of the new process? We ran focus groups with them at each new stage in the project. And while they were focused on getting to grips with the new processes, they were very positive about the changes and what they meant for the worker. And this quote from a case manager is one example of the responses we received from case managers. And they recognised that consistency was really important, so that each and every worker got the same experience, and that experience was a high quality experience. So this is the million-dollar question, right? Did it work? As usual, it's not as simple as a yes or no answer, but I'll take you through some of the indicators we saw when evaluating the project. Here is the distribution of responses to the Arebro questionnaire sent to injured workers. If you remember the questions that were asked, if the case manager judged the worker was having difficulty coping with their injury or had unrealistic expectations of recovery, the Arebro questionnaire was emailed out to the worker. What we see here is the distribution of the scores on returned questionnaires. The published cutoff for a high-risk score on the Arebro questionnaire is 50. We use the short form version of the Arebro questionnaire. And as you can see, there were some questionnaires received that fell in the low risk category. They're the blue lines on this graph. But most were actually in the high risk area. So when case managers suspect, I'll start that again. So when the case managers suspect the worker isn't coping, it is actually supported by the validated questionnaire that something should be done to support their recovery from a psychological perspective. And this provided case managers, many of the case managers, with the confidence they needed to actually act and put in place services that would actually assist the worker with their coping. So this following graph just needs a little bit of explaining. On the vertical axis, we have the proportion of workers who have returned to work. Along the bottom, we have time in days. A curve demonstrating a high return to work rate, high and early return to work rate, would reach higher and sooner on the graph. What we saw in the study were 3 main curves. The first curve in orange was for workers where the risk domains were not actually completed by the case manager. This curve reaches highest soonest, and it was the best performing group of workers. We take this to mean that there was a group of workers where the case managers focused on the steps necessary to facilitate return to work because it was imminent, rather than necessarily completing the domain questions. In effect, the worker was going to return soon, and in general, they did. The next curve in blue represents the workers where case managers completed the questions and all responses were in the low risk category. That is, no risk domains were highlighted as being relevant for that, being a potential delay for that worker in their return to work. This group's curve is not as strong as the first, but it is better than the third curve, where the risk domains identified at least one risk of delayed return to work. So the risk domains clearly identified workers at different levels of risk of delayed return to work. With over 70% of the domain questions being completed within the 4-week period, this provides an opportunity to effectively intervene during the window of opportunity, that being between 6 and 12 weeks. Not only that, but the area of focus for the case manager and other stakeholders has been clearly identified through the recovery blueprint process. The most commonly identified risks through the recovery blueprint process were the risk related to coping and risk related to the employer. So those 2 areas are a future area of focus. So to round out this talk about risk identification in real life, I wanted to quickly describe how Recovery Blueprint meets the stated principles of best practice. So to assess risk across multiple domains, I've talked through the 10 domains that the case managers assessed. Balancing the timing of information availability and the effectiveness of actions, case managers assess the domains when it's suited in the early phase of the claim, so they didn't have to seek specific information until it was necessary. This is perhaps most clearly illustrated in the orange curve on the graph that I showed. Some workers didn't need an assessment, and forcing it on the case manager would actually be getting in the way. Combining different types of information. The risk domains were assessed with a combination of case manager judgment and the workers completing a questionnaire. Using systems that can deliver clear information to decision makers. I haven't illustrated it here, but the case manager had an easy access to a summary of the assessed domains, as did any case manager who might be involved in the claim. Gathering information early enough to intervene when it counts. Almost 3/4 of the domains were assessed within 4 weeks, allowing for interventions to be initiated within the 6 to 12 week window of opportunity. Allows for systematic documenting and recording. The case managers recognised the consistency of the approach, and the data gathered was easily accessed but not buried in hard to find case notes. Combined automated and judgment-based decision making. The triage process used an automated process to identify risk of delayed recovery, and the case managers made judgments related to the 10 risk domains. And fits with the system using it. The process was designed to fit existing case manager practice and was integrated into existing case management software. As a result of applying all these principles in a pilot fashion within WorkCover, the decision has been made to roll out the process to the management of all 60,000 plus accepted claims each year. Thank you for listening in today. Please fire away with any questions. I'm more than happy for people to contact me via email afterwards. Thank you.
And thank you, Ross. So Ross will take any questions from the audience now. So please type your questions into your questions pane on the control panel. And just to remind everyone, further WorkSafe month webinars are running up until the 30th of October. So please do head to the WorkSafe Tas month website and have a look at what other webinars we are running here in Tasmania. WorkSafe month is also part of National Safe Work Australia month, so do also head to the Safe Work Australia page to see what is running at a national level as well. Ross, a question has come in. Have you published the results? If so, can they be looked up?
The publications of the results is underway. At Monash here, we're based in Melbourne. Obviously, we've been hit by a pretty significant lockdown lately, and that has actually had an impact on productivity in terms of publishing the results. Our plan certainly is to publish results. We've presented at snippets at different conferences at different times. More than happy for people to contact me as well, and I'll provide them with some background and information that might be helpful. But the aim is certainly to get things published and out there soon.
Okay, thanks, Ross. And the best way for any people to contact you is via your email address?
Email is best. It's ross.iles@monash.edu. It's ross.iles @monash.edu. And I'm always happy to talk about this project because it was a significant amount of time and effort from both Monash and WorkCover, and we've actually got some fantastic things to share and some great insights that we want to share with the industry as a whole.
All right, thanks, Ross. And to remind everyone that today's webinar has been recorded and will be available on WorkSafe Tasmania's YouTube page in the coming days. We don't appear to have any further questions coming through, Ross, so I'll begin to wrap up. So thank you, Dr. Ross Iles, Senior Research Fellow in the Insurance Work and Health Group at Monash University. And thank you for everyone for attending today's webinar, Recovery Blueprint, Introducing Risk Identification in Real Life. At the close of this webinar, you will receive a survey to complete. We appreciate you providing us with your feedback. Today's webinar has been recorded and will be available on the WorkSafe Tasmania YouTube page. On behalf of WorkSafe Tasmania and the WorkCover Tasmania Board, thank you for joining us, and thank you, Ross.
Thank you, Stephanie.